Welcome to today's webinar on BioFlex Laser Therapy, how to customize non-standard protocols. My name is Dr. David Konashko. I'm the Director of Education and Training. So today's agenda, we'll be going over an example of a standardized protocol, what that entails, so you can basically have a good understanding of all the different terminology used and how they're designed and set up. And then I'll talk a bit about non-standardized protocols. Perhaps you might want to change or customize a standard protocol or adapt it, or maybe even come up with a new protocol or for treating a specific condition that may or may not be found in the software itself. I'll give examples using the software of how to do this, so it should be straightforward. And then I'll talk a bit about Dr. Kahn's protocols and his legacy so that you can have a bit better understanding of where I'm coming from with respect to these protocols. Now, a standard protocol, in this case, the cervical spine, consists of three different stages, as many of you are aware. Stage 1, 2, and 3, really it's increasing in intensity and stimulation. A generalized protocol for a region, in this case, cervical spine, you would use it to treat most conditions around that area. So that might be facet irritation, degenerative disc disease, osteoarthritis, whiplash, soft tissue injuries, those kinds of things. Stage 1, 2, and 3, you can see there's different ranges, specifically for frequencies and duty cycle. Now, let's start from the very beginning. A treatment head refers to either a dual array or a laser probe. Now, dual arrays come in different sizes and shapes and so forth. We typically have the dual 180, the dual 240, or the dual flex. This particular protocol is referencing the dual 240. And of course, each array would have red emission of light and infrared. So when you see dual plus red or dual plus infrared, that's referencing one array and either emitting red light or infrared light. The LDI 200 in this case references the laser probe or laser diode infrared. That's LDI 200 is the approximate milliwatt of power. In this particular case, for treating the cervical spine, you can see that there's a duration of 5/5/5 for both red and infrared. And that's referencing three different placements. So in the case of the dual 240, which is a longer array, the array goes from the suboccipital region to the occipital region, and it will extend all the way down, typically to the cervical thoracic junction. That's the first array, so it's parallel to the spine. And then the second and third placement that represents the other two fives represent treating the right and left lateral side of the cervical spine. So that's what it references when we're saying 5/5/5. Under frequency, of course, we know that light can be a continuous wave, in which case there is no frequency or no duty cycle, light's coming out in a steady stream, or there may be pulses of light. So flashes per second are hertz, and you can see in stage 1, this referencing is 10 hertz to 50 hertz. Duty cycle represents the intensity of the light or the brightness of the light. It's like a dimmer switch. The lower the percent duty cycle, the less energy, the less power coming out, the less dosage. And it can range, in this case, from 20% duty cycle to 70% duty cycle. Whenever Dr. Kahn designed these protocols, he wanted to give the practitioner the ability to change or adjust the dosaging and the stimulation and the pulses in each stage. So you'll see it says a range 10 to 50 hertz and 20 to 70% duty cycle. The software will always start at the very lowest denominator. So we'll start with 10 hertz and 20% duty cycle. So that's a fairly low energy point to start, but it's a good point to start because you want to see how your patient responds. If they're responding well, continue using 10-20 or 10 hertz, 20% duty cycle. If you're finding they're plateauing or not responding the way you'd like, then you can either go to stage 2 or you can increase the duty cycle and the frequency within stage 1 because there's that range. So you might choose to customize the frequency to 20 or 30 hertz and the duty cycle to 30 or 40% duty cycle. You're still in stage one, you just happen to be a little bit higher level within stage one. And then, of course, if you look at stage two and stage three, you can see similarly, there's changes in frequencies and duty cycle as you range up. Typically, this would mean greater stimulation and greater overall dosaging. The rule of thumb for the most part is start at stage one and work your way slowly up to stage two and or stage three if necessary. And that's really based on how the patient's responding. If they're plateauing and not getting a better as quick as you'd like, you can start to increase these parameters. But however, if they're doing quite nicely and responding quite well, then you can keep them at that specific protocol. So that's what a standardized protocol is. Depending on your geographical region, Canada, the United States, Europe, Australia, different areas, they have different regulatory bodies that control what we can or can't put into software, the protocols, because they may or may not approve, they may not feel there's enough evidence to support the use of photobiomodulation for those specific regions or conditions. Usually it's a condition. It can be challenging because if you look at the body of research for laser therapy, there's thousands of papers to choose from, but it doesn't mean that there's thousands of papers on shoulder, for example, or herpes zoster, for example, or gout, for example. There's many examples where they may not approve the use of photobiomodulation as far as marketing goes into our software, because that's what they look at it. They look at it as if, well, this is something that you guys are marketing or saying it's effective for, and yet the research isn't necessarily correlating with that. Now, we know clinically it's very effective for many conditions because they're inflammatory in nature. And we know that the mechanism of action, it reduces inflammation. But of course, the regulatory body is a little bit stricter, and they do require very specific approval guidelines in order to put them into the software. So that's why you may or may not see some protocols that aren't in the software, depending where you live. However, if it's in your scope of practice, you can design and set up your own protocol for that. You can even base that on Dr. Kahn's own personal protocol manual that he makes available directly from himself as a clinician to yourself as a clinician, and not through our medical device company. Right, so non-standardized protocols, as an example, I gave you herpes zoster, but it might be something specific like Osgood-Schlatters disease, where, even though that's in the knee, it's a very specific condition of the knee. And because you're only treating the tibiotubercle region, you may want to customize or change the standardized knee protocol to reflect only one placement over the tibial tubercle, right? So that's an example of a non-standard protocol using a standardized protocol to set it up. In case of herpes zoster, typically that's not in the software, so you would need to develop that on your own or reference Dr. Kahn's personal clinical manual to see if he's referenced that protocol. There's other conditions that you may or may not see a protocol for, or maybe it's emerging use of it. And that's where clinical support and off-label use, we can guide you with that as well. So really you can create and name an infinite number of protocols depending on what you want to do. And you can save them for future reference for patients that have a similar condition. Right, so BioFlex as a company offers clinical support, and we're here to support you in development of specific protocols. So for example, Osgood-Schlatter, we might be able to help you out with that if you're uncomfortable doing that yourself initially. You may want to treat a very specific condition and you're not quite sure, and that's where we can help you out and guide you. And it's quite simple to take the information and insert it into the software as a very specific non-standard protocol that you embed into your own software. It is, however, really important to understand that whatever it is you're doing, it has to be within your own regulatory scope of practice if you're a regulated healthcare professional. I'm not a dentist, so I'm not treating something that I can't diagnose inside the mouth, because that's not my license what I'm allowed to do. But of course, everywhere it's a little bit different and there's gray areas. I get that. But it's up to you, your responsibility to ensure what you're doing is allowed under your specific bylaws, your professional bylaws, if in fact there's regulations as well. Okay, so let's look at the software. This is a dual port system, Practitioner Plus software. However, the software looks very similar if you're using the multi-port. Multi-port will have A, B, C, and D, because up to 4 ports. The dual port, of course, would have an A and a B. So the first thing you want to do in order to customize or add a new protocol is to click on the patient icon, right? So the person's head and shoulders there, you click on that, choose your patient, John Doe, click on and select John Doe. Once I've done that, I want to, first of all, understand that there may be on the Blueman protocols that come up with this. And it says the protocol set for your current region does not have a protocol associated to this anatomy. So I'll give you an example, the hip joint. Some of you may not, when you go to click on the hip joint, you may not be able to pull up a protocol. And that's because in the realm of laser therapy research, there isn't a lot of randomized control trials for the hip joint. Is it effective for the hip joint? Yes. But because it's not referenced in the research, we could not directly embed it into the software. However, it's very straightforward to do that using a protocol that you can reference from Dr. Khan himself personally, or by calling clinical support. So I just want to show you that may occur. So you would just click on OK. And then what you want to do is you want to set up a new protocol. Okay. So you're going to click on at the bottom, you can see it says new. You click on new. When you click on new, there will be a blank piece of information here, right? So let's say I'm going to do herpes zoster. So I'm going to type in herpes zoster. I'm going to type in stage 1 because that's my starting point. And then I click on add. When I click on add, it's going to give me one treatment head and show me what treatment head I want to do. So I click on treatment head, and then I choose the array I'm going to be working with, in this case, the dual plus 240. Then I'm going to click on duration, and I'm going to input the minutes of treatment. Now, this will be inputted based on the referencing Dr. Khan's personal clinical manual or through clinical support. We're going to tell you 5 minutes, 8 minutes, 6 minutes, 7 minutes, whatever that case may be. So in this case, we're going to type in 5 minutes red, 6 minutes infrared. Under percent power, it stays at 100%. Then under waveform. Under waveform, you'll see 2 choices, a continuous wave or a square wave. Continuous wave references the light's coming out in a steady stream of light. Therefore, there's no pulses of light. When you choose square wave, it's modulated, meaning that there will be a frequency and a duty cycle. In this specific protocol that Dr. Khan has designed over a few decades of use on herpes zoster patients, he has set the stage 1 at 50 hertz and 50% duty cycle for the red. Under infrared, he set the frequency at 10 hertz and 60% duty cycle. Now, at the far right, you'll see the number of repeats. All that means is you're going to place the dual array on your patient over, in this case, herpes zoster, and you may have to place multiple array placements to cover the area affected. I put 2, but you can change that to however number you need. And you can increase it or decrease it based on how the patient presents. Okay, so again, number of repeats just references the number of placements that you're going to put in. So do you recall when I talked about the cervical spine, I said there was 5/5/5, right? That's 3 placements. So in this case, we're doing 2. Now, after we've done that, we want to click on add again. Once we click on add, then we're going to see and choose the laser probe. So you click on the treatment head, find the laser probe that you're using. Usually it's the LED-I 200. Type in the total duration, treatment time. Type in the power. For this protocol, it's 30%. Usually it's continuous wave. Click on that. And then it says laser placement duration. Now, This is just recommendations. And if you've already watched a series of training webinars that I've done, I've mentioned that the time that you hold the laser probe to the skin will vary depending on what you're trying to do. If you're treating something superficial, generally speaking, you're only going to hold it for a few seconds at a time. But as you hold it for longer and longer, you build up an energy density in the tissue. And of course, that allows the light to be more effective at a greater depth of penetration. Okay, so in this case for herpes zoster, it's relatively superficial, at least where the lesions are. So maybe holding it for 4 or 5 seconds per point. Okay, now remember, the 8 minutes references the total time of use of the laser probe, not 8 minutes per point. So 5 seconds per point, and then you're going to do the math. Obviously, that's going to be quite a few points to cover all that area. However, 8 minutes is just a recommendation. You may need less or you may need more depending on the extent of the lesions. So once I've done all this, I've now created my herpes zoster stage 1 customized protocol, and I want to save it, not just for the patient, but I want to save it for also future reference for all herpes zoster patients. So to do that, I'm going to click on bottom left, add to customized protocols. When I do that, up pops the little box, and it will say herpes zoster stage 1. You type in exactly how you want it to phrase that, click on OK, and it will be saved. So now under customized protocols, you will see herpes zoster stage 1. Notice that I've already done some other ones there, but if this is the first time you're doing this, then you will see herpes zoster stage 1. Okay. Now, if I want to do herpes zoster stage 2 and customize that in, then it's simple enough to choose herpes zoster stage 1. Instead of clicking on accept, I'm going to click on customize. When I click on customize, it's going to pull up my herpes zoster stage 1. I'm going to rename it as herpes zoster stage 2, and then I'm going to make the changes according to the protocol. So in this case, I'm changing red to continuous wave, and I'm changing the infrared to 50 hertz, 50% duty cycle, and I'm changing the percent power of the laser probe to 100. So that is herpes zoster stage 2. Similarly, I click on add to custom protocols, change it to herpes zoster stage 2, click on OK, and now I have herpes zoster stage 2. Okay, so whenever I want to reference these customized protocols, if I go back to the very beginning, let's say I choose my patient, John Doe, right? Click on select. And if you ignore that little box there, I'm going to click on select from custom protocols. When I click on that button, instead of clicking on, prescribe a protocol, if I click on that, then I'm going to see, fast forward that, I'm going to see this. I'm going to see all those customized protocols that I've designed and set up. Okay, so you will have a growing list of protocols. It's up to you if you want to put in all of Dr. Khan's protocols or very specific ones or design some yourself. Over the years and months that you'll be using the equipment, you will definitely start to save some protocols that are unique to the patients that you see or conditions that you come across that may be a little bit different or not represented in the software itself. Now, to be clear, Dr. Khan has worked on thousands, to probably tens of thousands of patients over his lifetime. And during that time, he set up internal clinical trials, working with patients that have herpes zoster, gout, psoriasis, eczema, dermatitis, plantar fasciitis, hip pain, all these different conditions. Some of these protocols are in the software, and for reasons I stated earlier, some of them are not. He makes available through his own personal availability through our clinic to provide all these protocols to you. Okay, so if you're interested in them, you can reach out to Slava Kim, Clinic Director at Meditech International Rehab Clinic, or Nathan Chung, the chiropractor over there, and they can send you his complete manual so that you can take the information and, as I've just showed you earlier, how to customize it in. Okay, it's as easy as that. Or like I say, you may want to come up with your own protocol, maybe an Osgood Schlatter protocol. You can go to the knee, customize it, change it around however you like, just do one placement, save it as a Osgood Schlatter protocol, and now you have that all set up and ready to go for every patient that comes in with Osgood Schlatter. I thank you very much for your time today. Hopefully it was informative, and that you now understand the concept of how to customize in a non-standardized protocol. If you need to reach me directly, it's david@bioflexlaser.com, Slava, Kim, and Nathan at the clinic. You can see their emails below. And we also have another clinician and our director of clinical research, Dr. Ronaldo or Randy Santiago, and you can see his email below. Thank you very much.